Assalamu alaikum. Welcome all to the Human Anatomy channel. In this video, I discuss anatomy of the pericardiosynthesis. Do you know a sound knowledge of anatomy is essential part of any clinical procedure? Let's start the discussion. What is pericardiosynthesis? It is a procedure that used to a needle to remove fluid from the pericardial sac that surround the heart. This is the wall of the heart and this is the pericardial cavity with excess amount of fluid. The common site of the pericardiocentesis, the apical and left sternocostal and subxiphoid approach. The apical approach. A needle is inserted into 1 to 2 cm lateral to the apex pit and in the 5th, 6th or 7th intercostal space through the upper border of any rib. You should avoid the lower border because intercostal nerve and vessel is related here. And in this approach, you can easily use the cardiographic guidance to insert the needle. And there is another advantage. This left ventricular wall is a safe seal after puncture. And here the pathway to reach the pericardium is shorter, and according to the by using gravity, the more amount of pericardial fluid can be collected through this approach. And that is a risk because the peritoneal pleural sac is near to the apex of the heart, so risk of pneumothorax here, and there is also risk of puncture of the left ventricular wall. The parasternal approach, here needle is inserted into the left 5th intercostal space close to the sternal margin, and you have to insert within less than 1 centimeter or within not more than 1 centimeter lateral, because there is one of the important arteries present here, internal thoracic artery. So to avoid the puncture of the internal thoracic artery, the needle have to insert just lateral to the lateral margin of the sternum. And one of the advantages, you can use echocardiographic guidance to visualize the pericardial cavity, and there is a chance of risk of pneumothorax and puncture of internal thoracic artery if you insert the needle lateral to the lateral margin of the sternum. The subxiphoidal approach, this is xiphoid process, this is the subcostal margin and this angle, and the needle inserted through this approach toward the shoulder joint, and you see the anatomical relation here. This is the liver, this is stomach, diaphragm, and needle have to approach through the toward the pericardial cavity. So there is a chance of puncture of the liver and puncture of the stomach. So you have to be careful about this. And one of the advantages, there is a little chance of pneumothorax. So this is the approach. If you go a little bit lower, there is a risk to puncture the stomach or the liver. So this is the relationship of the sternum and pleural sac, and this is one of the site of pericardiocentesis, another site of the pericardiocentesis. Place of the patient is semi-reclining position, 30 degrees from the ground. So due to the gravity, the aspiration of the fluid is more easier. So there is a video. Subxiphoid approach. This is the pericardial effusion, pericardial fluid, identified xiphoid process. So this is all about today's presentation. If you like this video, please press the like button. Please subscribe.